It's morning in Kunchi town in Kunchi local government area of Kano State, and Hadiza Yunus Abdullahi is getting set to go to work at the community health center. These are the women supported by the Foundation Year program to gain entry to professional health courses. Women for Health's all-embracing goal was to increase the numbers of female health workers, and a total of 2,801 have entered professional courses since the program began, thanks to Women for Health working with the colleges to increase female admissions and to gain full accreditation and increase their capacity. These young girls and women are beneficiaries of a noble initiative called the Foundation Year program, the key intervention introduced by Women for Health. The Foundation Year program is a remedial program designed to help young women from rural areas reach the academic standard needed to gain admission and graduate from health training institutions in the 5 focal states. Women for Health sponsored the beneficiaries, who all signed a bond agreeing to go back to their communities to work as midwives or nurses for at least 2 years after they graduate.
We got everybody to understand, government, everybody to understand. This Foundation Year program is for rural women only. It's not for anybody. We visit the rural areas. Before you become a Foundation Year student, you have to be nominated by your community. Not only nominated by your community, we will go into what we call community bonding. The community must invest in you.
Funded by UK aid from the British government, the Women for Health program has been working in Nigeria since 2012. It targeted the 5 northern Nigerian states of Kano, Katsina, Jigawa, Zamfara, and Yobe, as they had severe shortages of skilled health workers, particularly in rural communities.
The communities we are working with, many of the hospitals in those communities do not have health workers. Even if they have, majority of them are men. And because of that, they don't want to go to the hospital. So with this problem, DFID decided to introduce Women for Health solely for the purpose of increasing the number of female health workers. So mark you, female health workers.
Women for Health worked to improve the number and capacity of female health workers and also contributed to women's empowerment and gender equality in many communities in northern Nigeria. This woman brought to this health center died a few minutes ago following severe bleeding after delivering a baby at home about 5 hours ago. There was no functional health facility in her village, and the only access road had flooded following a heavy downpour overnight. Preliminary checking by a senior health official here indicated that the woman died on the way to this health center. This scene gives a typical picture of the challenge in the healthcare system in many rural communities in Nigeria.
Is it fair to us women that when we are giving birth, we should lose our lives? It's not. And it is wrong. And the only thing and let us, people can say it is her time and became fatalistic. I don't think so.
Women who give birth in rural communities are 3 times less likely than their sisters in urban areas to be attended by a skilled provider.
The need, it's mostly in rural areas. So I can give you a quick example. Let's say in Kano or Katsina city, if I'm not satisfied with the government hospital, I can go to the private. I can pay, if I have the means, I can pay and access care in the private hospital. But for many of these rural areas, they are completely dependent on the service, on the public hospital.
Over the last 8 years, the program has focused on transforming the education of health workers to make sustainable change.
There are inadequate infrastructures, inadequate tutors, the equipment inadequate. And we realize this is too, we looked at the budget we have, and we looked at the need. We realized we cannot match it up. So, and we really want to upgrade the status of the school to have full accreditation and to be able to produce 100, not 30. So to do that, then we decided, okay, we need to knock at the door of the government. So we went to the government. After a lot of negotiations, backward and forward, alhamdulillah, the state, and this is general, all the states have really invested in their schools.
Today, after support from Women for Health to enter training, Hadiza Yunus is a fully registered midwife. She is here performing her routine antenatal service to women in her community. The Women for Health program recruited young women already living in rural areas for training, with the promise to return to their home community to provide culturally appropriate health services for girls and women.
Before, I was a complete housewife. No job, no anything to do. They took me, they sponsored me, and I have completed my midwifery profession. I am now a registered midwife. Before, we don't have any health worker to conduct delivery here. We took our sisters, parents to Kazauri. Even during night time, I used to come here and conduct delivery. Before, no one to come here and conduct delivery before. The training I have received from Women for Health, I will just say, thank God and thank this program.
I encourage her through financial issues, through even my efforts to carry her there, go encourage her in terms of some speeches in such a way that she will have this thing as she's our representative. All Kunchi local government, we don't have a graduate from Women for Health, from basic midwifery, or less her.
Interestingly, most of them, they came without being able to speak. In fact, some of the interviews, they said they came, they didn't know how to speak in English. Within a short period of time, they are able to make it. There were some who came with no credit, but within the 1 year, in intensive support, coaching, they were able to make it. And for me, if there is any satisfaction I derive from this project, is how the transformation within a short period of time, you see, when the girl comes in, and after 6 months, 1 year, the change, the impact you've made in the life of these girls is unbelievable.
So far, Hadiza has influenced her husband's other wife who has enrolled in a school. She is also aspiring to become a midwife. Hadiza has become a role model for young women in her community. Hadiza's story is the story of many young girls and women in the 5 focal states where the Women for Health has worked over the last 8 years.
Thanks to Women for Health, who make me to be a very good, wonderful midwife, and I can do my work independently.
Ƙwarin gwiwar da zan ba mata 'yan uwana da suke gida ba su zo sun kai wanga karatun ba shine ina kira gare su kuma ina ba su ƙwarin gwiwa da su tashi tsaye su yi wanga karatun domin yana da muhimmanci ga rayuwarsu, ga rayuwar al'umma, ga rayuwar ƙasa da kuma makwabta da dama.
Before, our deliveries in number is not up to 20 women that get part in this facility, but now we increase to become 30 up to 40 in a month.
No word can really capture the joyous feelings in my heart when I think of how Women for Health has touched my life.
Women for Health also made an effort to be recruited as a staff in Kaduna State.
They did everything for us to see that we passed that examination. They even paid our examination, NECO and WAEC.
Women for Health has helped state governments to understand the plight of rural communities, the urgent need for more health workers, and the importance of improving health training institutions. The states have since taken ownership of the Foundation Year program.
We all have this assumption that our government, they are useless, it's not so. One lesson I've learned is that once you make the right, you are very transparent with them, and you're honest with them, they will take it on.
By the end of October 2020, Women for Health would have ended its program in Nigeria, and it has set up measures to ensure sustainability.
In all the states, legislators have been fantastic. They've given us all the necessary support we need. So they make laws establishing FYP as an intervention in the state. So the funding, the government agreed, decide on how the funding will come. And the legislators will appropriate the money, and they release the money.
We did our best to see that this bill has been passed. With that bill, people are happy that FYP comes to stay.
One of the key achievements of the Women for Health program is the transformation of health training institutions in the 5 focal states of Jigawa, Kano, Katsina, Yobe, and Zamfara. In 2018, Women for Health also began working in Borno, which faces a similar lack of health workers as well as a humanitarian crisis caused by a decade of armed conflict. Through resource and technical assistance, Women for Health has supported health training institutions in the 5 focal states to gain full accreditation status, which means they can increase the number of students in each year group.
This issue is not something you can dodge the situation, because we're talking about women's life. So they must be trained properly so that they don't become risk to our women. So for them, they set up certain guidelines which must be met. So for example, for every class, for this number of students, you must have this number of classes. So for example, they come with a student-tutor ratio. For every 10 students, there should be 1 teacher.
In Jigawa State, Women for Health built additional classrooms, offices, common rooms, hostels, staff housing, crèches, in addition to the renovation of existing structures.
One of the challenges were also hostels. So we built hostels. In all the schools, we built hostels. In all the schools, we built classrooms. Not only ordinary hostel, we also built hostel for also married women. Before our coming, the school consider if you're married or you in any way became pregnant, that's the end of your program. We said, no, that's not women friendly, not in northern Nigeria. And that was how we built hostel for married women, so that we try to address the issues that our women are facing and why our women, especially from the rural areas, from the local government and rural areas, why they will not come.
In Katsina State, accreditation remained provisional for decades due to substandard infrastructures, and infrastructure is one of the key criteria for accreditation. So, Women for Health renovated and expanded facilities in all the health training institutions in the state. The program also built brand new practical demonstration rooms at the schools of health technology Daura and Kankia, and indeed in all 5 states. This is in addition to solar-powered classrooms, which give students access to e-learning resources.
We install a lot of videos, a lot of, so the tutors have produced their own lessons and their own materials, and then we converted it into an interactive materials. We call it Modu Mobile. They can download anywhere they are and be able to continue reading.
In Yobe State, the Nursing and Midwifery Council of Nigeria had closed down the School of Nursing. Women for Health built and renovated the laboratories, hostels, practical demonstration rooms to standard. It also built a new School of Midwifery and provided the School of Health Technology in Nguru with a fully equipped practical demonstration room. In Jigawa State, the College of Nursing and Midwifery, Kudu, had only 17 qualified teachers. After the intervention of Women for Health, the number was raised to 57. Since the Women for Health program started in 2013, external examinations results across the supported health training institutions has improved remarkably.
We met many of the schools on the average 56, 54 pass rate, but now many of them minimum 80%. It's for the past 3 years, many of them are now passing 100%, 90-something%.
Traditional rulers and community leaders are central to the success of the interventions because they are closer to the people. Women for Health had reasoned right from the inception of the program that the consent and approval of the community leaders is crucial to the implementation of the program.
Our gratitude, first of all, to the government of Britain, British government, UK government, for supporting this program.
The UK government has funded the Women for Health program and other health initiatives in Nigeria for many years as part of an international development policy targeted at the poorest communities. The Foreign, Commonwealth and Development Office, FCDO, formerly DFID, which funded the work in Nigeria, has focused on maternal and reproductive health. More than £31 million has been invested in the Women for Health program.
From the start, we've planned in and built in a process for handing over from the program right from the beginning. In many states, one of the things that we did was to support them to really own those schemes. And many states have, in fact, practically all the states have passed legislation that creates the Foundation Year program and that funds it funds it over the long term.
This program supported us to have girls from the rural areas to be trained and go back to the rural areas and support our health system.
We will continue to sustain this program because certainly it will reducing the loss of lives of children.
The Nursing and Midwifery Council of Nigeria is the body statutorily responsible for ensuring safe and effective nursing and midwifery care to the public in Nigeria. It has been working with the Women for Health program in the accreditation of health training institutions in the focal northern Nigerian states.
And because of the interventions and good working relationship, I want to tell you clearly today, all the 5 states have 100% increase of their intake, and almost all of them had their accreditation full status, not even professional. And that has drastically increased the productions and the training of nurses and midwives in those states.
The success of the Women for Health program, especially the concept of the Foundation Year program, has impressed some Nigerian states and has paved the way for them to adopt it. Kaduna State, for example, has reached advanced stages of implementing its own foundation year program. Kaduna State has chosen 10 local government areas in the first phase.
The reaction of the people is indeed encouraging the Ministry for Local Government to even try to extend the entire program across the 23 local government areas.
Because of the demand, I so much believe there is no any administration that will come and maybe neglect the program. The program, it has come to stay.
They trained us in how to actually go through the processes of the admission, how to do the costing for the FYP. They also educated us on how to, at least, let's say, the curriculum that we are expected to use.
In order to ensure sustainability, the Women for Health program has been working with the Center for Gender Studies of the Bayero University, Kano. Working closely with the center, Women for Health established the Human Resource for Health Learning Hub. The hub offers health professionals and managers across Nigeria the opportunity to learn from experts the practical solutions and experience of successful interventions supported by the Women for Health.
The hub is to serve as a repository for all the work that Women for Health have done in Nigeria. That is one. Then secondly, it is to also serve as a place for conducting researches, trainings, advocacy, collaborations with other health units of the country and even abroad. And the main aim of the whole project was to get more female health workers in rural areas.
Success is usually measured by achievements. The Women for Health program between 2012 and 2020 has achieved most of its set goals and objectives. Women for Health has assisted in the full accreditation or raising the accreditation status of 24 health training institutions in the 5 northern Nigerian states and Borno. 2,801 rural women have enrolled in the Foundation Year program. 556 female students in the Foundation Year program have successfully graduated in all the 5 focal states. Women for Health has also built the following: One other notable achievement is the midwife recruitment and retention scheme, which has assisted in increasing the number of rural midwives. Incentives included monetary specific allowance, gender-friendly rural accommodation, in-service training and placement of midwives in functional rural health facilities. E-libraries in all 6 states were renovated and equipped with solar systems, computers, servers and updated e-materials with a developed e-content. 431 students from the Foundation Year program, representing about 99%, have been successfully deployed to their rural communities as health workers. Women for Health has laid the foundations for change in the northern states. The production of health workers and access to maternal and child health services is improving, and ultimately this will save the lives of women and their babies.
I will summarize Women for Health as a very pleasurable experience for me and a successful one. because of the difference we've made in the lives of certain group of people who will not have had that opportunity. Without Women for Health, many of them would not have had that opportunity.